the first year of life, the bones of a baby's head can shift or mold into a variety of positions. Certain areas of the baby's head can become flat or misshapen. There are a number of ways to describe this condition, including positional plagiocephaly, brachycephaly, and others. The flatness can be directly on the back, causing the head to appear widely shaped with the ears rotated forward. The flatness can also be on one side of the head, causing fullness to the forehead and a forward rotation of the related ear. This can happen when a baby's head is pressed against a hard surface for long periods of time. It can happen from the use of any type of baby carrier. This includes car seats, swings, strollers, or any firm surface that a baby rests their head against. The American Academy of Pediatrics recommend that parents place their infants on their backs for sleep. This is an important guideline to follow because it has reduced the number of babies lost to sudden infant death syndrome by nearly 50%. If you're not sure about these guidelines, check the AAP website under Guidelines for Sleep Safety for more information. Now that babies are spending more time on their backs for sleep, the number of babies with plagiocephaly has increased. But there are certain things parents can do to lessen the chance the baby will develop a flat area. It's a matter of remembering to reposition the baby's head.
I think prevention is the way to start, just like any other problem or disease, is just educating the parents on what to do, because with SIDS, they're just told, hey, you got a newborn, put your child on their back. And they never even thought about that the crib or the car seat may be harder, and that's what's causing the deformity.
Here are some simple and easy to remember tips. Start tummy time as soon as you bring the baby home from the hospital. Starting early will help the baby to accept this as a familiar position.
Parents should be told about plagiocephaly and repositioning their child right after delivery. It's so important to start tummy time right as soon as you can. Do all of the repositioning, that way it prevents it. Prevention is so much more important than treatment, I think. And sometimes it's inevitable that it'll happen, but I think if parents are educated on the prevention of plagiocephaly, that we would see a big decrease in it.
She was 6 months old when we found out that she had a flat head. We had gone to her doctor for her 6-month checkup, and he noticed that her head was flat, and so he referred us to a specialist. And every night I would wake up 4 to 5 times because I noticed that there was one side that she favored the most. So I'll just turn her, and we made sure that we had lots of tummy time.
Tummy time should take place when the baby is awake and alert. And remember, it's important to always supervise them. Start with a few minutes several times a day, like 5 minutes 3 times a day. Take advantage of the time right after a diaper change or a nap. They may not like it at first. Be persistent. Be creative. Tummy time can be spent in a lap, resting on the chest, or playing on a clean, solid surface on the floor. As the baby gets older, increase the time. An easy goal is to aim for at least an hour a day in divided sessions, and increase the time from there. The baby can be much more active in this position than if left in an infant seat or carrier. In fact, tummy time simulates motor development. Babies learn to push up with their arms and lift and control their heads. They also practice moving their feet and kicking with their legs. Infants will strengthen the muscles that support their head and develop flexibility as they reach for toys. They see their world from a new perspective. Under supervision, an older brother or sister can be assigned to play with the baby. If you notice any areas of flatness, spend more time in tummy time, and remember to reposition the baby throughout the day. Tummy time is one of the best things you can do to help the baby build strength and develop motor skills. These skills help them achieve milestones like scooting, sitting, crawling, and eventually pulling up to things and walking.
If we just keep the cognizant that we need to move them, change shoulders, change feeding positions, rotate him like we talked about, that will be probably the easiest, earliest prevention to help let the brain then round out the skull.
Rotate the sides you hold the baby for feedings. One feeding, hold them in your right arm, next time the left. Try to do this when you carry the baby too. Pay attention to how much time the baby spends in the car seat. Always use a car seat for travel, but use alternative ways of carrying the baby while shopping, visiting, working around the home, or any activity. Again, remember to reposition. Remember to always put the baby on their back to sleep. Alternate their head, one time to the right, the next to the left. If the baby can position their own head, change the location of the attraction like a mobile or whatever they like to look at. Babies tend to look towards the center of the room or at the door, so one night place their feet towards the bottom of the crib and the next night the top. Once the baby is asleep, you can turn their head. There are important things to watch for. If you notice that the baby always tilts their head to one side or favors a certain head position, talk with the baby's provider. This could be caused by a tightening of the neck muscle that prevents the baby from being able to turn their head. This is called torticollis.
She was around 5 months old whenever we got in for the first appointment with plastics, and they went ahead and measured her head and did an overall assessment of it and decided that yes, it was pretty flat and that she did have torticollis and favored the right side a lot more. So they talked to us then about possibly doing the helmet therapy, or there are other less, I don't want to say invasive, but less invasive techniques that we could try at home.
The provider will refer you to a physical or occupational therapist to learn exercises that will loosen the neck muscles that support the head and allow the baby to fully turn their head. Torticollis is treatable and must be corrected to prevent plagiocephaly or an existing flat spot from getting worse. If you notice that the baby has a flat spot, a misshaped head, a hard ridge that forms along any of the bones of the skull, or premature closure to one or more soft spots, also called fontanelles, see the baby's healthcare provider. This could be a serious condition called craniosynostosis. It can easily be mistaken for plagiocephaly, and therefore, the baby needs to be evaluated by a trained professional.
If a mom is concerned about head shape, it's very appropriate to ask our healthcare professional, hey, is this just the world shifting plagiocephaly, or might it be a fusion? Because we don't want to miss that.
Untreated craniosynostosis can lead to serious complications like pressure to the brain and developmental delays. At times, regardless of effort, some babies develop a flat area. Talk with the baby's provider. He or she may refer you to a specialist that can treat the baby with a helmet, also called head banding.
The treatment was very effective for Piper. She actually was in her helmet for 7 weeks, 23 hours a day. She had an hour break each day for us to clean the helmet and give her a bath. It sounds like a lot of time in the helmet, but honestly, after the first day, she didn't even realize it was there. And her overall head shape improved 90%.
Diana is, she's 5 years old now, and she is perfect. Her head is perfect. I'm glad we didn't need the helmet.
Treatment time varies depending on the severity of plagiocephaly, consistency of wearing the helmet, and the baby's response to the treatment. After 12 months of age, the therapy may be started, but the results may take longer or not be as effective as the baby's skull is not as flexible. Prevention and early intervention are the goals. But parents should be reassured that many infants with positional head deformities will improve over time, and hair growth will likely hide imperfections. Remember, it is important to follow the American Academy of Pediatrics Back to Sleep guidelines. It is also important to place the baby on their tummy to play to prevent plagiocephaly and be aware of how much time the baby spends in any one position. So, remember to reposition.